All right. Okay. So I'm the Vice President of Transformation at Sick Kids. I'm also the chair of the Virtual Care and Carbon Emissions Working Group, which is part of a TAHSN community of practice established to support the advancement of sustainable health systems. So for those of you who are unfamiliar with TAHSN, it's a collection of 14 hospitals in the Toronto area, the Toronto Academic Health Science Network, and it works in partnership with the University of Toronto. Today, our plan is to showcase some of the tools that we've developed to support sustainable virtual care, and specifically tools that measure the reduction of carbon emissions. So my hope is that you'll see value in these tools and hopefully also adopt them for use in your own hospitals. Now, I know I'm speaking to many like-minded individuals who understand the critical role that we all play in preserving the environment and tackling climate change, not just for ourselves, but of course, for our generations to come. But what may be a bit of news for some of you is how much the healthcare sector actually contributes to the degradation of our environment and by extension, the health of the population we serve. So conversely, what is true, of course, is how much difference we can all make in this sector by taking actions to limit the impact on the environment. So we are, after all about healing and wellness. So to that end, I thought I'd kick things off with just a few quick comments on this topic, and then I'm going to turn things over to our panelists who will discuss the potential environmental benefits of virtual care, the tools that I mentioned, and also some of the early successes we've had related to their implementation. So Marella, if I could get you to move me to the next slide, please. And I'm going to start with this slide, which has a fairly startling statistic. Can you believe that the healthcare sector in and of itself is responsible for an estimated 4.9% of greenhouse gas emissions? So often we think of factories, belching out smoke into the air or emissions of aircraft as key contributors, and they are. But I doubt that most people know that the healthcare sector is also a major contributor, and especially the general public. So as Canadians, I also think we should be a bit embarrassed by the fact that we have the second highest healthcare admissions per capita relative to other higher income countries. So clearly we have some catching up to do. One of the countries that's taking this very seriously at the moment is the United Kingdom. I encourage you to do some research on the actions they're taking in the healthcare sector if you haven't already to curb emissions. It's been quite impressive. And it's one of the countries our community of practice is looking to in terms of adopting and learning best practices. Next slide, please. So the impact of all these emissions on climate change is dramatic. Obviously, and I think you'll have to advance the slide, Marella, because it has a few little bullet points there. It threatens our health and health equity. In particular, lower income and racialized communities are disproportionately affected. It threatens our ability to provide high quality healthcare, for example, by diverting resources away from primary prevention and health promotion to treat acute care and diseases like COPD. And perversely, it's contrary to our mission as healthcare providers. We're directly contributing to the negative impacts on population health. So it's our goal and our responsibility to ensure that we're limiting this impact whenever we can. And hopefully today's discussion will contribute to that goal. Next slide, please. I pulled this slide from a presentation that my CEO recently did, presented at a conference on sustainability, because I think it does a kind of a really good job of showing the direct link between climate change and health outcomes. And these impacts range from very specific to the broad. And they're things we want to prevent, obviously, in the field that we've dedicated our careers to. So what can we do to address this impact? Through the deployment of the playbook that we're going to share today, and by implementing and integrating the scorecard and calculators as part of our virtual care pathway, hopefully we'll be able to move the needle on how we measure and track carbon emissions. And I think, measurement's the first step. It's hard to change what you don't measure. So armed with this data, hopefully we can not only demonstrate and publicize how we're contributing to a better environment, but also provide people with information to make informed decisions about how they may wish to receive their care. So with that brief introduction, let's get started. To kick things off, I'd like to introduce Nicole Sims, who's the executive lead of Cascades, which is part of the Center for Sustainable Health Systems at the University of Toronto. Nicole is going to walk us through the environmental benefits of using virtual care, as well as demonstrate how our virtual care carbon accounting tools work. So over to you, Nicole, and then I'll introduce the rest of the panelists as we get to them. So over to you.
Thanks, Peter. Just share my screen. I'm hoping everyone can see this PowerPoint.
Yeah.
Great, thank you. So as Peter mentioned, I am going to chat with you about how we can kind of understand the role of virtual care in sustainable health systems, and also show you a tool that can be used to actually estimate the role that virtual care can play in improving the sustainability of the care that we're offering. Just want to quickly acknowledge I'm joining you from the University of Toronto, which for thousands of years has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit, and is still the home to many Indigenous peoples from across Turtle Island. So very grateful to be able to work on this land. So I'm going to briefly give you a framework for thinking about low carbon, high quality care, and just discuss kind of where virtual care fits into that framework, because I think, you know, there's so much, there's really an explosion of activity going on in this space around adaptation and resilience on the one hand and mitigation on the other. And I think this framework is really helpful for thinking about mitigation, reducing our contributions to climate change. Then I'll talk about the environmental benefits of virtual care. And then again, I will show you the calculator that we've developed at Cascades. So first, this framework for low carbon, high quality care. And this is a framework that was developed by Dr. Andrea McNeil, Forbes McCain, and Jody Sherman. And you can see that it has three different kind of components, and I'm going to walk through each of these quite quickly. So the first item here is to reduce the demand for health services. So first and foremost, we want to try to improve health to reduce the demand for care. We know that only about 20% of health is the result of the actual provision of health care itself. The rest of it is related to all kinds of other factors. So what can we do to try to improve the social determinants of health, to promote good health, to prevent disease, to better manage chronic disease so that it doesn't develop into more serious health conditions that require carbon intensive care? So that's kind of the first step in the framework. However, despite all of our best efforts, sometimes care is going to be needed. When it is needed, we want to ensure that it is appropriate, right? So we know that a lot of care that happens is not appropriate. It's either not being delivered appropriately. So for example, people going to the emergency room instead of having a primary care doc that they can rely on, or it's simply not necessary. So I have a quote here from the Lancet that an estimated 1/5 of prescriptions, 1/4 of tests, 1/10 of procedures, and almost 20% of supply chain expenditures are thought to be potentially unnecessary. So we need to figure out how to really match the supply of health services to demand. So when we have figured out the kind of care that is appropriate, we then need to figure out how we can reduce its environmental impact. So that's kind of the last step in this framework. And you can see there are many different items here, and virtual care is one of them. So I will speak to this in a moment, but there are some other things here like coordinated care delivery, for example, that digital technology can also help us achieve. We are focusing today specifically on virtual care, but digital technology itself does offer, you know, a host of potential environmental benefits. But I do also have here the breakdown. So Peter mentioned that the NHS England is very far ahead in working on sustainable healthcare. They've done a breakdown of their health system, and you can actually see where much of the emissions in the health system are coming from. They're coming from the supply chain, which to most people is a bit of a surprise. People think, you know, oh, hospitals are large facilities. Of course, they're producing a lot of carbon emissions. but it's actually primarily related to the supply chain. And there's also a good chunk in there that is related to travel. So we're focusing on patient travel here. There are implications for virtual care for staff commuting and visitor travel as well, but just focusing for today on the patient travel aspect of this. But I hope that gives you kind of a sense of how we think about mitigating the contributions of the health sector to climate change and where virtual care fits into the mix. So what are the potential environmental benefits of virtual care? We've already touched on them, right? In an ideal world, virtual care can improve access to care. It could result in more integrated care delivery. Digital technologies can offer patients potentially the ability to better manage their health. So here's a paper on the effect of home monitoring via a mobile app on the number of in-person visits following ambulatory surgery, which were reduced by use of this mobile app. So great potential there. In the future could reduce the need for large-scale facilities, but again, today focusing on the travel emissions averted through reduced travel to care facilities. And so again, bringing in those figures from the NHS, we do know that a significant amount of carbon emissions within the health sector are related to travel. And I just have some figures here from a UK study where they estimated the carbon emissions associated with different types of visits. And this is really what virtual care helps us avoid. It helps us avoid the carbon emissions associated with a patient coming in to see their GP. Even, there are some virtual emergency services. So even emergency room visits can, in some cases, be replaced by virtual visits. And I just want to stress here that in talking about the environmental promise of virtual care, we are not suggesting that all visits should be replaced with virtual visits, because we know that in many cases that's not appropriate. But in cases where a virtual visit is deemed appropriate by both the provider and the patient, considering the environmental impacts of care is just another factor that could go into the decision making. And I'm not sure, Bobby might talk to you about the different times in which a virtual visit has been considered most appropriate, like for example, on a prescription renewal. Not sure if he's going to go there, but we do know that there are certain types of visits that, a virtual visit works really well for both patients and providers. So just want to keep that in mind here. I also want to note that there are specific reasons for which virtual care offers a particularly sustainable alternative to in-person visits in the Canadian context. So first of all, we know from the work of Canada Health Infoway that there is public support for a greener option. So in their national survey, they included some questions on this. 84% of respondents said that they were personally concerned about climate change, and almost 70% of people said that knowing that virtual care can reduce healthcare's greenhouse gas emissions would make them more likely to opt for a virtual visit. So this is actually something that people care about. Recent adoption rates indicate capacity. So through COVID, we learned very quickly that we actually can provide care on a large scale virtually. Again, not all of that virtual care was appropriate, but we know that we can do it. So that's important, because a few years ago that wasn't evident. But perhaps most importantly to the Canadian context are these last 2 points, that we have a relatively high percentage of gas-fueled vehicles on Canadian roads. So getting those vehicles off the road makes more of a difference than it would in a place where a higher proportion of vehicles were electric or hybrid. We also have a relatively clean Canadian energy grid. So in thinking about the environmental benefits of virtual care, we do need to think about the emissions associated with the technology that's used to facilitate virtual visits. Most virtual visits, we know from Canada Health Infoway's work, take place via a smartphone, right? Just a call. Some of it is via video platforms, but using your smartphone, streaming videos, those things do produce emissions. But because our energy grid is so non-emitting in Canada, they are basically insignificant, especially relative to those gas-powered vehicles. In a country that had, you know, a grid that was heavily reliant on coal, the equation would shift, but that's not the case here in Canada. So hopefully I've given you a sense of the potential environmental promise of virtual care. I now want to show you the tool that we've developed at Cascades to try to actually estimate the environmental savings. And I do want to stress that these are estimates. So the virtual care carbon accounting playbook is available on the Cascades website. For those of you who don't know Cascades, we stand for Creating a Sustainable Canadian Health System in a Climate Crisis. We're based at the University of Toronto in the Centre for Sustainable Health Systems. And we have several partner organizations, UBC's Planetary Healthcare Lab, the Healthy Populations Institute at Dalhousie, and the Canadian Coalition for Green Healthcare. And this initiative and this calculator really arose out of one of the working groups of the TAHSN Council for Health Sciences Sustainable Health System Community of Practice. So that's where this originated from. And we developed it. It's been available on our website for the past year. So the purpose of it is to help healthcare sites better understand the carbon emissions associated with patient travel. We also threw in costs to patients associated with travel, just in case that was something people wanted to estimate. So the tool will give you a few different outputs. It will give you your travel-related carbon emissions savings in the case of virtual care, or costs in the case of in-person care. So on the virtual care side, you can see the carbon emissions that were saved because patient travel was averted. Or if you do want to know the amount of carbon that's being produced in association with your in-person visits, you can figure that out as well if you want to input that data. Again, we did add in the financial savings and costs. So on the virtual care side, it will show you the total financial savings to patients from travel averted, and that will include cost of transit fare, or if they're driving, gas, insurance, vehicle wear and tear, and parking. Or again, looking at the in-person visits, you can estimate the costs. And the tool will also give you a forecast. So if your site has particular objectives with respect to virtual care, and what we seem to be hearing is kind of in the ballpark of 25 to around 30% is what some sites are deeming is sort of the appropriate amount of virtual care provision. You can look at different, these different percentages kind of based on where your patients are coming from, what the forecasted savings would be, the carbon and financial savings of virtual care, or what the forecasted virtual and financial cost of in-person care would be. So the tool is actually an Excel spreadsheet. It has 2 pages to it. There's a main page where you put in most of your inputs. And then there's also a place for you to input information on where patients would have been coming from. So you basically need to know the number of virtual visits. If you want to put in the number of in-person visits, that's fine. You do need your facility's forward sortation area. That's just the first 3 digits of your postal code. And then you can either calculate the distance yourself if you want to use a tool like Google Maps, or the tool can do it for you, but you do need the FSA, those first 3 digits of the postal code, for all of the patient visit, or for all of the patients that had virtual visits. You need the first 3 digits of their postal code, and that is information that will have been collected, that will exist somewhere in your system. So it's a matter of figuring out where it is and harnessing it. I will say you'll hear from a couple of sites who have taken the calculations in this tool and have integrated them into their own dashboard so that this just seamlessly fits in with their data collection. We did decide to make this as a standalone spreadsheet, just so that sites could download it and use it themselves. They don't have to go to any external site. So if this is not integrated into your dashboard, you can just download this and use this internally. So I won't spend too much time going over this because this is available on our website and you can take your time looking at it. But this is what it looks like. There are some items that you have to input manually. There are other items that we have default values for, but you could change if you want. So your virtual visit volumes, that's not something that the tool would know. But for the average emissions factor for a personal vehicle, for example, we've added a default value there based on the average. You could change that if you wanted. And then I do just want to call your attention to this jurisdiction dropdown. Based on census data, we do have information on mode of transportation for several sort of census metropolitan areas. And what that will do is break down the kilometers to and from the site by the likely mode of transport. So if you're in Toronto, for example, it will assume that 40% of those kilometers were driven on a bus, or that 10% were active transport. So the emissions will be adjusted. So that's a neat part of the tool that allows you to customize it to your location. In terms of the travel data, it will give you round trip distance from the patient's home to the site and then back. So again, you just need those first 3 digits of the postal code, and then it will map it straight line distance to your facility and back. A lot of assumptions being made here. Don't have time to go into all of them, but they are noted in the calculator so that you understand, what some of the limitations and assumptions of the tool are. And then it will give you your carbon and cost savings. It looks like this. There will be values there. It also gives you a link to the Natural Resources Canada conversion calculator, because most people don't know what 100 kilograms of carbon actually means. So this is a nice tool because it puts it in terms that actually mean something. So if you're doing any reporting on the results of this tool, this could help you put it into terms that people can understand. The forecasting looks like this. Again, you can just select different percentages and it will let you know what the likely or what the estimated costs and carbon savings are. Limitations, again, estimates across inputs. We have not included ICT related emissions. We started off trying to do that, but again, they ended up being quite difficult to calculate, but where we could estimate so low that they were not really relevant. Obviously, we can't account for changes to practice or health outcomes related to virtual care. That's a bigger picture question. And then we think this is a useful tool because, immediately it helps us get a handle on the extent to which patient travel is contributing to a site's carbon footprint and how virtual care could mitigate it. Could help us embed a sustainability lens into hospital culture. And then potentially in the future, it can help us integrate our findings into a decision-making tool for patients and providers. It could inform calls for extended or permanent virtual care billing codes, and it could potentially help us link health outcome data to virtual care utilization data. So I'm going to stop there, but I do encourage you to explore the tool on our website, and please get in touch if you have any questions. And if you do start using it, we'd love to hear how it's going.
All right, thank you, Nicole, and thank you for all of your work that you've done, you and your team on this, development of this tool and with Cascades. It's been awesome. I also just while we're here right now, want to recognize Cheryl Wansell as a senior project manager with Sick Kids on my team, and Morella, my executive assistant, who've been supporting us with today's session, as well as with the group, the Community of Practice Working Group. One question that came up was, are we going to share these slides afterwards? I think that we're fine doing that, and we will make sure that we distribute those afterwards. And as Nicole said, you can go to the Cascades website to get this particular tool. As far as Q&A goes, I think I'll hold that till the end, just because I worry we run out of time. So if you do have a question, I know some people have to leave early. If you can email those questions to Cheryl and or Morella, we will make sure that those questions get sent to the right person to answer them for you. Okay, I just want to give you that assurance. one question that comes up is, does it work? Has anyone you tried this out and used it? So that's the next part of our presentation. So I'd like to introduce you to Ashley Graham, who's a senior clinical manager of digital and virtual care at Sick Kids, as well as Jenny Ng, who's the manager of quality and patient safety at Sunnybrook. They're going to tell you what their experience has been integrating carbon measurement into the practice of virtual care. So I think Ashley's going first. And so I'll turn that over to you, Ashley, if that's okay. Thank you.
Wonderful. Thank you so much, Peter. And I will give a little bit of context to Sick Kids and where we're at with virtual and dive into how we were doing calculating before, which was me using a calculator very manually and not taking into consideration some of the things that Nicole mentioned as additional factors to consider. And it's not just equating kilometers traveled directly to emissions. There's other factors that this tool now lets us do a better job of providing that information. So at Sick Kids, and I'm going to also talk only about our ambulatory virtual visits, not the other areas in which Sick Kids provides virtual care, because that's a area where we have not explored this tool yet. And so these are our pillars of virtual care in our ambulatory area. And this is what virtual care since the beginning of the pandemic and actually leading up to the pandemic looked like. Obviously, it looks similar, especially at the beginning, to many other areas where there was a huge spike in virtual care. Orient you to this table where blue is the virtual visit volumes, gray is the on-site visit volumes, and the orange is the percentage of virtual. We do remove from this calculation areas in which were determined not to be the best areas to have virtual visits. So dentistry, diagnostic imaging, our day hospital treatment, and our research only visits. While some of them do have virtual visit components, research, for example, we don't include those in our calculations here. This also includes those within and outside of Ontario. And taking all those visits and where the travel piece comes in, especially the quaternary care or tertiary care that Sick Kids provides, you can see there's obviously a great concentration within Ontario, but we do provide virtual visits for patients across the country. And so prior to having the tool, we would present this information as fun facts to put a different context into what our mandate for increased virtual visits actually translated to for patients and families. And so then when we had the tool, we've been able to have, again, a bit more accurate information sharing. And then also in our Children's Council meetings when I'm presenting on virtual care, as well as I use these slides when presenting to our clinical ops teams and leaders to, again, what does this actually translate to? And again, it puts a little bit of a different perspective on when you think of how big an elephant is, what that means in terms of metric tons, and what that then translates to and how we have made an impact on savings. So the kids and adults find these fun facts useful information. And again, for just putting into context what this means. Most recently, we have the tool that was in Excel that Nicole just went through in detail is in our Power BI dashboard, which is fantastic as well. So it's a much quicker way of being able to calculate this information. I'm going to actually just pull up the, see if this will work. So we can actually look by specific department. We can change the date range. Right now it's our last fiscal year, and we can include or exclude the information that we would want from there, and then it gives us this information. Again, this is only for our ambulatory visits. So it will be a great tool, and this is just a recent addition to our dashboard, but will be a great tool as we work towards how the virtual care at Sick Kids factors into and is included in the overall Sick Kids environmental sustainability strategy. And obviously we're not going to pick patients for visits who live further just to increase our target, but it does need to be considered how we are going to incorporate this. And then, as I said earlier, how do we take into consideration our virtual urgent care, our virtual critical care and diversion of patients from having to be transferred to Sick Kids, our remote patient monitoring or remote care management. How does that get factored in? Because that's not necessarily a visit, but will we reduce visits by improving our remote patient monitoring or remote care management? How does that factor into our environmental sustainability and carbon emission savings? So I ran through that really quickly because I know there's going to be one for discussion at the end. And so we can save questions till the end.
Great, thank you, Ashley, and thank you for talking about the elephants in the room, carbon emissions, right? And yes, we'll hopefully have some time for questions at the end. So we'll turn I'll turn things over to, and also thank you for being an early adopter and contributing to the development of the tool. Jenny also is an early adopter and contributed much to our learnings. So I'll let Jenny take over from here. I don't know if you have any slides, Jenny, or not, but
I have slides.
You do.
I have no
Okay, you're all right. Good, you're live, you're on. We can see your slides, so go for it.
All right, I have no elephants to share, but I can share our journey in virtual care. So I'm Jenny, and thanks for inviting me. I'll share with you our journey for adopting the virtual care carbon accounting tool. So just wanted to start with a little bit of context of where we're at for data and Power BI. So at Sunnybrook, we do have a culture of data sharing and just data use for helping us make informed decisions from an operational perspective. So we have an existing Power BI tool that we log into. Most leaders log into it they feel like every day to take a look at their occupancy, wait times, et cetera, et cetera. We do have program priorities. And so when the opportunity came to review the virtual care accounting tool, I thought, great idea to put it in here. When we reviewed the tool, we liked that it was an Excel document, so it was great for us to manipulate or see out the calculations. But with the amount of data, amount of patients that come through Sunnybrook every year, we thought it'd just be easier for us to put it onto dashboards so that we can visually see it. So looking at the dashboard, so we built our Power BI with a lot of help from Nicole and her team. We worked with our decision support. I'd really hoped to bring my team on to talk to you about the technical specifications and how we created this, but they were unable to join me today. So I'm going to try my best to talk about the specs, but we did try to do a dashboard that gave us a lot of information on emissions, travel, and just what our savings were. So this is an organization view for us right now on how it would look like. So based on all of the clinics that we have at Sunnybrook that do virtual care, this is how we perform. So you can see here, kilometers saved. We have emissions in tons that we can see year over year, and also total trips. When we did decide on what to include on the dashboard, we looked at virtual and phone and grouped that together because we wanted to make sure that we don't miss those people who call in for quick calls, consultations, and just updates to their appointments. We did a little bit of back and forth with looking at some of our distance calculated. So Nicole had talked a lot about how we did the straight line calculation, which we did as well. But we also looked into the census data. Sunnybrook is unique, being outside of downtown core. We do have quite a lot of car use, but when we looked at the census data that was provided in the tool, they gave us the specific proportion, but because of our location and our proximity to, or lack of proximity to public transit, we had to make some minor adjustments. And so when we looked at our FSAs, anything outside of the Toronto area, we assumed that they came by car, just because Sunnybrook does not have, or we're not close to subway, so we took that assumption. So we did have to do some calculations and some changes in the background to ensure that we do capture it correctly. And on our review of the data, we noted that we had quite a lot of people outside of Ontario that were participating in virtual care. but we chose to exclude them in our calculations just because we wanted to keep it clean, and we weren't sure if they were flying in or if they were really calling, like we weren't really sure what their mode of transportation was. So we kept it to Ontario data only. It was interesting when we reviewed the data, when we looked at our carbon footprint savings. Not surprisingly, during the peak years of pandemic, quite a lot of virtual care use. As things started normalizing, people came back on site, starting to come back up here. This is not complete data, it's 23, 24. We're hovering about 21%, but we're hoping to normalize probably around 25 as the year finishes off. So I am from quality and patient safety, so I took this from a QI perspective. So I'm going to give you an example of how we adapted the tool from a QI opportunity. When we did launch the tool, I think we had launched this probably in December 2022. We didn't do too much fanfare on this, but we did launch it to most of our organization. What was interesting was we had a lot of students, a lot of fellows, a lot of clinic managers reach out to ask for more information on this tool. A couple of QI people had reached out to understand how they can evaluate their QI projects with a sustainability metric involved. One of them I wanted to highlight was Amy, Jessica, and Laura's team. They are looking at virtual visits for cochlear implants. Their project for QI, so this was a funded from our department project, but they proposed a solution. They had, for cochlear implants programming, what they do often is that they used to invite people on site, they do a couple of adjustments, and then they're sent back home. These appointments are quite short, and oftentimes these patients are quite far, so they thought, why can't we do this virtually? They worked with a vendor and they successfully implemented a program where they were able to do adjustments for patients on Zoom or on video or call, so that it enhances their satisfaction and it reduces their travel time. When they ran their pilot, I think they started probably in the fall. It's been a couple of months. They did their evaluation using our tool. They did not use our Power BI tool because when we did look at the data, not every clinic at Sunnybrook registers into our data system. So their clinic unfortunately did not do that. So they took the spreadsheet that Nicole had and filled it out themselves. Based on the pilot they had, they were able to demonstrate that they had 138 hours of driving time saved. They had tons of carbon emissions saved. They were able to look at travel cost, including parking, and also did the calculation for 80 trees that were planted. So it was really successful and was shared with a lot of our clinical teams, also shared with our leadership team, and people just really appreciated seeing that it was evaluated from a sustainable perspective. And we're also able to capture patient information to say that with this new program, they were able to, they enjoyed it. Who doesn't like saving money? And it was just great because they didn't have to come into the hospital for a simple adjustment. So overall, I think that it's been a great tool. More and more fellows and QI leaders have reached out just to hear more about the tool. So I'm excited that maybe in a year or two, we'll have more examples to share, but these are early days of how we applied it.
That's great, Jenny. Very, very impressive. Thank you again so much for sharing and also for, again, your contributions to the tool and the work that you're doing for us. I should also introduce, I mentioned that Nicole and I are part of this working group. There's a couple of others on the call here today who are part of that group. Kyle Robinson from Sick Kids, who's the architect of the Sick Kids environmental strategy, and Professor Jeff Anderson from the University of Toronto joining us today as well. And we have another member you're about to hear from right now from Canada Health Infoway, Bobby, who's going to share the perspective maybe from the patient lens and hopefully you find this interesting as well. So while you bring up your screen, Bobby, I just want to also note, and Ashley touched on it, what's next, remote monitoring, other types of things that we can do. Jenny's thinking as well about other applications. And one of the things our group will be studying is looking at the impact of integrating digital tools, things like remote monitoring and measuring, trying to measure the whole life cycle impact from a carbon perspective with the integration of those tools. So that will be fun. That will be interesting. It'll be informative, and we're just starting to work on that, including with some folks from England who are helping us. But Bobby, I'm going to turn it over to you. If you can maybe share your screen, and we'll talk about your tool, then hopefully have a little bit of time for questions.
Perfect. Thank you very much, Peter. And hello, everybody. Can you see my screen?
Yes, we can.
Okay, perfect. So as Peter described, this is a slightly different tool with a slightly different purpose, but we had developed it together, and a special call out to Nicole for providing a lot of input and expertise that went into the development of this tool. Essentially, we're hosting this as part of our Infoway Insights website, which is a site that we use to share insights from the primary research that we conduct in the form of national pan-Canadian surveys, surveys of Canadians, surveys of clinicians, which we use to inform the digital health landscape, Infoway's strategies, and some of our strategies of our partners. So before we go into the actual tool, I just wanted to play up on some of the points that Nicole made in her presentation with respect to use of virtual care and where virtual care may be appropriate as a substitution for in-person care. And I'm just going to refer to the research that we conducted. This is a study of Canadians. We surveyed 12,000 Canadians from across the country in a representative survey. And it covered a broad spectrum of different topics related to digital health. But I'll focus on the virtual care aspect and show you some interesting stats. First of all, use of virtual visits in the past 12 months by modality. So we can see, in 2022, about 18% of Canadians said they used video virtual care. 13% said they used text or email, and the majority used telephone visits, about 46%. And now, as far as who they saw, for the most part, it's their family doctor or regular place of care. And in terms of the modality for their most recent visit, we can see again that telephone is the primary means for conducting virtual care, which also plays into the point that Nicole was making around the cost of the environmental cost of these technologies, and the fact that telephone is ubiquitous. There's not a large cost in terms of emissions for providing telephone access. So we can assume pretty much that the benefits are in terms of avoided travel and resultant emissions. The other point I wanted to touch on was the preferred modality for different types of encounters. So as Nicole said, not every visit should be a virtual visit by any means, but some are more suited to a virtual visit than others. And when we ask Canadians about this, prescription renewals came out as only 16% of Canadians said that if you want to renew a prescription, you should do it in person. For the most part, Canadians want to do it virtually. Minor health problems. Again, the majority would prefer some type of virtual visit rather than in person. So the gray here is in-person visit. But then as we go down the list, we see that some things are just better suited for an in-person visit, like annual exams, routine examinations, and so on. So it's interesting to collect some of these perspectives and see where virtual care can really be applied. So given that, I'm going to take you to the virtual care calculator tool, which is the focus of this discussion. So I'm just going to scroll down here and go into the page. So first of all, a little bit of background about the tool, and a link to a paper that Nicole and I and one of my colleagues, Waldo Beauséjour, wrote about a year or two back, just outlining the methodology behind this. So if you're interested in that, you can access the paper from here. But I'll walk you through how the calculator tool works to give you a sense of its functionality. So it's user driven. So as a user, I would go to the page here and input answer some basic questions. So are we talking about a hospital visit or primary care visit? We'll say hospital in this case. And also describe the community. Do you live in a rural area, urban center, or somewhere in between? And by selecting this, it inputs a default value here around how far people typically travel to access the hospital closest to them. This is all based on that Canadian Digital Health Survey. So these are average values for Canadians, and depending on which setting you choose, if you live in an urban center, you likely have to travel less distance than if you do in a rural area. So we'll pick one of these just for the example. And the other selection here is the mode of transportation. So by default, it's car, but you can select van, SUV, EV, public transit, and that will all impact some of the default values in terms of emissions that are used in the calculator. For this example, I'll pick SUV since it's one of the larger emitters, and we'll get some bigger values. The other parts here that you can customize in this tool is how much time do you typically need to visit the healthcare provider? So again, average values are, on average, Canadians spend 1.5 hours to go to an appointment and come back. But users can move the slider here according to their experience to customize this tool. Same thing around some of the costs related to visits. So dependent care expenses, let's say you don't have any dependents, for example, you can move that down to 0. If you do, again, you modify accordingly. And then types of the cost to travel. So we know we've got average values here. On average, Canadians, it costs them $37 to visit a healthcare provider in person. But it depends on where you live. It depends on where you have to park, etc. So you might need to switch this up or down. And then also we factor in income loss. So if you have to take time off work, we know on average people lose $56 in income by having to take time off work to go see a care provider. And how many visits are we looking at per year? Is it one visit? Do you have perhaps a chronic condition that requires you to make multiple visits throughout the year? So let's say we'll put in 3 in this case. So after you've filled in these factors, you can see, okay, so by choosing a virtual visit instead of an in-person visit, according to these parameters, you can save yourself about 5 hours, $378, and avoid about 20,000 grams of carbon emissions. Interesting. What does that mean? Well, using that same NRC calculator, this converts it to something that we can understand a little better. Well, it turns out this doesn't make a huge impact to the environment. So you're not changing things across Canada very much by choosing your visits virtually. However, if we were to extrapolate this to a larger population, then those numbers change. So let's say, you know, if 30% or 20% of hospital visits were virtual, then we can see what kind of impact that would have. So the numbers get significantly bigger across the country, and so do the benefits. So it's the equivalent of taking 85,000 cars off the road in this example, if we make all these assumptions. So in a nutshell, that's how the calculator works. And as you can tell, there are a lot of assumptions that go into it. It's a very general tool. And the primary purpose for this is awareness. So we want to make Canadians aware that, you know, choosing virtual care in some circumstances is beneficial for the environment, can improve the sustainability of our healthcare system. Can it actually translate to you know, concrete peer-reviewed outcomes? No, this is not the purpose of it. It's more just ballparking what potential impacts could be achieved. So again, it's more of a conversation starter. It's an awareness builder, and then something that could be looked at for projecting, you know, if behavior changes, what might happen, versus Nicole's tool that looks at what actually did happen and what outcomes were achieved. So that's pretty much what I wanted to share with you, and I'm going to share a link to the website for those of you who are interested in playing around with the tool, and also looking at some of the survey results that we have posted there. And I'm happy to take any questions that you may have.
All right. Well, thanks, Bobby, and thanks for bringing the patient voice to the table and also showing some of the ancillary impacts to patients and families who have to travel for appointments. And you can obviously see if we all took a lot of action here, could make quite a big difference to our missions as a country. So anyways, lots of information. There's a couple of links in the that have been posted in the chat to the tool. So you can, but you can also go directly to the website, I believe, to get those tools. As mentioned earlier, we will send out slides, and because there's a lot to digest here, so you can take your time looking through those. Love to get your feedback when you do try out the tools or look at the materials. And certainly you can funnel questions if we don't get to them today to Cheryl or Morella, and we'll make sure we get back to you. Just a big thank you to all the panelists for your efforts today and sharing this knowledge. Also, thank you to all the attendees for coming out and listening to us today. We're excited to have you. Really hope that you will try out some of the tools that we've presented and continue this journey of supporting environmental sustainability. So with that, we do have some time for questions, and I think we can do that in a couple of ways. One, you can put that in the chat, but I believe you can also put your hand up in some way, and we'll try to field those for you. And I'll do my best to direct it to the appropriate person, unless you have a specific person that you'd like to speak to about your question. So over to participants here for questions of our panel. All right, we have a lot of quick learners here, I think, in our group.
Can we ask questions of the
like Piers, why not? Let's
well, I mean, I think it would be great to hear from people who have joined, you know, where your thinking is at on just virtual care in generally within your institutions, and if you have been making any efforts to think about the environmental benefits, because when I first met with Ashley, I was so surprised that they were already doing these calculations themselves. This was already part of the data that they were collecting, and I thought that was really, really great. So very curious about whether other sites are already thinking about that, or if this is your first time being exposed to maybe this relationship between virtual care and sustainability, if this does seem like something you might be interested in integrating into your data collection.
All right, question to the field here. Any thoughts on that? Or any concerns about what, if you want to know, what are the big, what challenges you think you'll face by trying to adopt any of these tools? Could be another. Or you just want to eat lunch. Okay, I can't see the hand. Oh, there we go. Varma, yes, please go ahead.
Thanks, Peter. Varma Maharaj from Trillium Health Partners out in Mississauga. We did have our director of clinical informatics join. That she had to unfortunately jump off, but she was texting me and she was intrigued. So we haven't quite made the connection yet between sustainability and virtual care, but it is something we're interested in pursuing. The one thing that kind of stands out in my mind is the amount of data collection and consolidating that into the reports, the great reports that you guys have presented today. I mean, did you need any staffing enhancements for that, or were you able to fit that within your existing workflows?
All right, well, I think that's a question for Ashley and Jenny. So either one of you want to take those, or both of you?
Sure. And for us at Sick Kids, we already collect that information. It's already part of the database in terms of the FSA or postal code information, and it was already accessible to my team, or a member of my team who deals with the data. What took him longer, and Parham's here, so feel free to jump in, Parham, but to figure out how to make everything talk to each other. So it was something we already had access to, so we didn't have to increase any staffing.
So you were able to sort of set up reports where this information was collated and became automatically summarized.
Yeah, it was about again, Parham can speak more to the technical side if you want to jump in there, but it was already in the database that we had access to.
Yes, so as Ashley mentioned, we already had this method of calculating the two-way distances between postal codes associated with each appointment to Sick Kids. So that made the integration of the tool easier, and we just had to feed that kilometer saved into other calculations that we translated from Excel sheet into our Power BI dashboard. And yeah, that was about it. But the main decision and challenge that we have is currently we are using Ontario level transportation data, and we want to go more into depth and use more like CMA level data from Toronto, and yeah, that's one of our challenges.
Okay. Any Jenny, anything you want to add here, or is that?
Nothing to add. We have a similar process. We already collect FSA data. So it was easy for us to manipulate that. Yeah,
I think the data part is probably the challenging part, making sure you can easily integrate that and without much effort. Yeah. We have a couple of other questions in the chat here. Who are from Caitlin, who are the change makers determining or endorsing this as a strategy for patient care? I'm assuming that's related to virtual care. I don't know, Ashley, this is your area. Maybe you want to take that one on?
Sure. I think please jump in, Caitlin, if I'm not understanding your question correctly. Virtual care was a strategy put in place actually, or was initiated prior to the pandemic. The pandemic gave us that burning platform to make it move a lot faster than it had originally been planned. And so in terms of we are busting at the seams, as Peter can attest to even more, in terms of sick kids. And so actually virtual care is a strategy for space reduction, because then we will have greater capacity to see patients who need to be seen in person. So that actually is important for us as we move forward with patient care of the future.
Okay, thanks, Ashley. Let's see, there are a number of questions here in the chat. We'll try to get to those. Actually, it looks like we're out of time, so I'm not sure we have too many more people left on the line here. So maybe what we'll do is try to follow up with these questions instead. I don't want to take people too far past their timelines, but really appreciate all of the interest in this topic. And do please play around with the tools, ask your questions. I'd love to get you on board and using the tools. But in the meantime, I think I'll wrap things up here, since people are having to drop off. But thank you for your time today. And we will get back with those questions following and circulate the things that we did. So, yeah, so have a great day. And yeah, hopefully we'll connect with you soon. Take care.